Okay, so let me sort of take you on the story of a young lady. She had heart failure, and it ended up with a different story at the end. This was a lady who, at a very young age of around 22 years, came with history of dyspnea on exertion, which was progressing over the last couple of months. And she also gave history of giddiness and headache, which was coming on and off. And she had some episodic neck stiffness, which she didn't really bother, thought it was due to some other issues. And this was there since 6 months. And this came out after questioning, which she did not immediately volunteer. She was not on any regular medications apart from some analgesics. And at the point of presentation, she had no other illnesses. She had on exertion tachycardia, BP was on the lower side, peripheral pulses were felt, no peripheral signs which are of any significance. The cardiovascular system examination showed systolic murmur and diastolic murmur. ECG sinus rhythm, just a few T inversions, and the blood investigation showed some amount of pancytopenia, and chest X-ray increased pulmonary vascularity, and there was some calcification which was noted on the chest X-ray. And this was the echo, and in the long axis, you can see that both the valves are significantly calcified. The aortic root also is normally calcified here with the extension into the aortomitral area. And the closer look of the mitral valve shows some movement of the leaflets, but it is a lot of calcification involving the annulus and the part of the base of the leaflets. There was not much of regurgitation. And these are images of the aortic valve, a lot of calcification again here, and some amount of AR here, tri-leaflet aortic valve, and more involving these two cusps over here. And this is the short axis of the mitral valve. Not great images, a lot of reflection, a lot of problems were there in terms of artifacts, but you can have a rough idea that you're fairly confident of saying that the commissures are free. So the calcification is there, but the commissures are free. And this is look at the pulmonary valve, calcification here also, but not causing any obstruction. So there's no gradient here, just normal acceptable measurements. And this is a look at the left main. So left main shows calcification again here, but no sort of luminal compromise. Fourth chamber more or less confirms whatever we saw on the parietal long axis. And a closer look at the tricuspid valve showed some specks of calcification, and there was also some caudal calcification. So at the gradient estimation showed moderate stenosis of the aortic valve and moderate stenosis of the mitral valve. So calcification everywhere in this young lady. So at this point, it was multivalve disease, and mainly involving the mitral and the aortic valves, and to some extent the pulmonary and tricuspid valves. So significant obstruction of both the valves, but not much of regurgitation. Aortic root calcified, left main calcified, with normal LV and RV function, and there was borderline LVH and mild pulmonary hypertension. So the question at this point was, what was the cause? So in view of her neurological symptoms, she was sent to the neurologist, and they opined that she had focal dystonia, which was mainly at the cervical area. And there was some soft signs, cerebellar signs. She had some postural tremors, and they made a diagnosis of median nerve neuropathy also, and oculomotor apraxia. That means that she was not able to fix her gaze. So that was one of the other problems. She was not able to read properly or even to look at things properly. And for this, she was sent to the ophthalm and then confirmed the same thing and had early papillary edema. And I guess she was asked to consult even the hematologist because of the pancytopenia. So now I think we are getting a picture of where there are multiple involvements here. And the blood investigations, some basic investigations were normal, including the homocysteine. Ultrasound showed hepatosplenomegaly, so one more system involved here. And MRI confirmed that she had features of hydrocephalus. So multi-system involvement, cardiac, neurological, ophthalm, hematological, and abdominal organs. So she went for a bone marrow and enzymatic testing, and it came out as Gauchers disease, which is a very unusual and a very rare disease. So what exactly is Gauchers disease? So this is an autosomal recessive lysosome storage disease. So that means that there is a deficiency of this lysosomal enzyme. So that is the glucocerebrosidase. And because of this deficiency, there is accumulation of the glucocerebrosides and other glycolipids in the macrophages. And what happens is these macrophages starts to move around and they get deposited in various organs, and that's how they cause dysfunction of the various systems. So there are three types. So type 1 is the most common, but there's no neuro involvement here. And in type 2, it's predominantly neuro, and it's more of an early onset at a much earlier age, and the prognosis is pretty poor. Type 3 is the neuro involvement. So in our case, there is also a type C also in under 3. So there's where there's cardiac involvement, and this is very rare. So she had a type 3C, and this is the diagnosis that was made. And in type 3C, when there's cardiac involvement, generally there is pericardial, myocardial involvement, valvular involvement, and also the great arteries involvement. So she underwent enzyme replacement therapy and she recovered. And then a few months back, she also underwent a replacement of the valves. So my message is, as far as this patient is concerned, is that when there are young patients, and especially when there is multi-valve calcification, especially left-sided, importantly, when there is a systemic involvement, one should think of other causes. So usually we sort of tend to look at rheumatic heart disease as the most likely cause, but when it is systemic involvement where there are multiple systems involved, one should look at other less frequent or rare diseases. So differential diagnosis in this patient, one is rheumatic heart disease, and it could be radiation induced, but usually they give a history of radiation. Some amount of cancer history will always be there. Hyperparathyroid, in her case, it was normal. So this again needs to be ruled out. So based on this, the Gauchers disease, and this is the differential diagnosis. So all calcification, one has to be careful in looking at other causes also. Thank you.